Hello everyone, this is Bob Brown with Community Coronavirus Update number 93. We'll talk about the mixed Nebraska numbers, natural immunity debate, and vaccinating pregnant and women and children. So if you look at this first picture here, I was in Washington, D.C. last week for a meeting, and one of my things I usually do when I go to D.C. is I walk down to the Lincoln Memorial, but on the way they have this memorial they put up, and essentially every one of these white flags is somebody who's died from coronavirus. You see the number up there, 693,000. As you know, we're well over 700,000 now here a week later. My tradition is to walk down to the Lincoln Memorial and read Lincoln's second inaugural in the Gettysburg Address. I think this is one of my favorite lines in a presidential speech, with malice toward none, with charity for all, with firmness in the right as God gives us to see the right, and really finishing up the work to bind the nation's wounds. And I think we're in a very similar point in history. We've lost just as many Americans to coronavirus as we lost in the Civil War, with a lot of the same divisiveness in politics, unfortunately. So with that, we'll talk about the rest of the subjects today. So first is, data in Nebraska. It's kind of a mixed picture. Here in Lincoln, Lancaster County, our numbers are dropping steadily. We put in the mask ordinance over a month ago, and we're going to extend it for another month. I think it's definitely the right thing to do. Now, Nebraska as a whole is kind of a mixed bag. And part of the problem with guessing how much of a mixed bag is just the data. We have put up our rates again so that you can look at your own county level rates and combine counties on our public Tableau site. You see, of course, the big gap there when our dashboard went away. And here, where I grew up in Sidney, Nebraska, which is Cheyenne County, Chapels, Dual, Kimball, those rates are about double where we are here in Lincoln right now. So I think the epidemic is worse in rural Nebraska right now. This is a little more helpful, but again, there's a lot of uncertainty in the data. I like the New York Times. They actually use a combination of both current positive tests and positivity rates, because when your positivity rates are really high, your spreads are really underestimates. And I think this is maybe a better view of Nebraska. Unfortunately, though, but because we have a lot of rural counties with only a few hundred to a few thousand people in it, the numbers can flop around a lot. So I wish I could have this, but do it at the public health district level. Kind of like this, where it sort of evens out those county level fluctuations a little bit. And this is up there, and Ted and I are going to work on improving that here in the next week or so. But anyway, Lincoln, Lancaster County numbers, they're definitely a nice downward trend, and that shows up on our hospitalization rates. If you look at the people in Lincoln hospitals, we have roughly 100 hospitalizations in Lincoln, but most of those are people from outside of Lincoln. So our Lincoln hospitalizations are dropping pretty dramatically, and that's freeing up more space for us to take folks from outside of Lincoln. Bryan Health, again, putting out some of the best visuals in the state, so they've gone beyond the hospitalization for vaccinated, unvaccinated breakdowns. They're also producing, the number of their patients from Lincoln, which is dropping, versus the ones coming from outside of Lincoln, and even putting sort of a geographic spread. So this is where everybody in Lincoln's hospitals are from, actually. So we're taking care of a good chunk of Nebraska's sick COVID patients as they overwhelm their rural hospitals. So in Nebraska overall, the Nebraska hospitalizations overall are pretty stable, hovering a little over 400. If you look at Douglas County, they've got about 200-ish people, so about half the state's hospitalizations are in Omaha, about another 100 or a quarter are being taken care of in Lincoln, with the rest of the hospitalizations spread out around the state. Trend, I think one of the things we need to get people to have a better understanding, there's a lot of misconceptions and misunderstandings about the natural immunity and vaccine effectiveness. And so this would kind of be the bulk of today's talk. So I think part of the problem is people jump to conclusions about coronavirus based on other infections without realizing that coronavirus is a unique novel infection. You can't make assumptions that it acts like either measles or influenza or something else. And so people made these early assumptions and quit looking at the data. And so yes, there are infections like measles or chickenpox, for example. And that what this is our Rotor Youth Exchange forms for kids who want to be exchange students. And overseas, you have to verify all of this stuff to be an exchange student. So this is nothing new to verify your vaccination status. I don't understand why people are claiming that this is somehow an infringement on your liberties to verify vaccination. But essentially, if you have had measles as a child, you really don't need the measles vaccine because you're immune for life. And some people jump to the conclusion that coronavirus acted like that. And a lot of us hoped. I mean, I actually thought a year ago, I was like, wouldn't it be nice just to get an asymptomatic infection, be done with this? It turned out, unfortunately, that is not how coronavirus works. There are other infections that are temporary, and this is more like that. And so we'll go through some of that data. So, we learned this the first time in January when this study was published out of Manaus, Brazil, where early on they had a huge wave, and they estimated somewhere around 3/4 of the population had gotten coronavirus. And the natural herd folks thought, hey, here we are. Brazil proved it for us. They're good now. Unfortunately, what happened is a new variant came through, and the second variant that came through was actually worse than the first. Now, was this because the immunity from here waned over time, or was it because a new variant escaped the immunity? We still don't know for sure which one of those it is, but regardless, there's still another surge. And this is what we've been seeing across the world ever since. So in the United States, we had the initial surge, and though this didn't peak very high because we just didn't have enough testing. So those people just frankly didn't get diagnosed. So the real surge was probably would have been up in here if we had the same amount of testing. We had the summer surge in this Faust, the winter surge, a slight peak because this was alpha up in Michigan, and then our next surge here. And respiratory viruses do this. This is kind of a typical surge pattern for respiratory infections. It doesn't act like measles or chickenpox, and so we need to get people over this idea that it's one and done. Michigan we'll talk about a little bit, and so you have to be careful about looking at national rates because they're just a sum total of all the 50 states rates, all of which will act a little bit differently, have different timing. So if we go to Michigan, you'll see a very different story. They had an initial surge. They didn't have the summer surge because they didn't let it rip like the South did, in the middle of 2020. They had the big winter surge, and because they were on the front end of it, there was enough waning immunity over time that when Alpha came through, they had a big surge that the rest of the country did not get. Because they had this late Alpha surge, it appears that they started later than the rest of the country on this Delta surge, but here they are going back up again because you're having some waning of this immunity to Alpha. Doesn't always translate to Delta. And is it waning of immunity time or escape of a new variant? We still don't know the full picture, but we're getting better data on that now. So, for example, so now we are finally getting United States data on the effectiveness of vaccinations over time. Now, in this study out of the Lancet, it's Pfizer vaccine, and basically what you see here is that the protection against infection seems to drop for all age groups by about 6 months, and so you may still get infected. However, the hospitalization protection is still pretty good, actually. Interestingly enough, maybe there's no waning for 12 to 15-year-olds, and we actually do see this where HPV vaccination, for example, 12 to 15-year-olds only need 2 shots, whereas older people need 3 shots. So there may be some difference in boosters based on age, and that would not be surprising to me. But essentially, the protection of infection is waning over time, which fits with that seasonal resurgent pattern. The question is, if you've had a natural infection, how long does it last? And unfortunately, no longer, and if anything, it might be shorter. So here's this other study looking at the range of a number of different coronavirus viruses and how their immunity protection lasts. And one thing you'll notice that the SARS-CoV-2 has the shortest duration of immunity of all of these, with a range anywhere from 3 months to 5 years, with an average of 16 months. So yes, there is waning, but sometimes as little as 3 months. But the other question is this immunity to that variant, does it to the next variant? So maybe you've got 16 months of immunity to Wuhan, but maybe you don't have 16 months against Delta. And so that's the other question. So which variant do you have immunity to? And that's what your antibody test can't tell you. So just because you have a positive antibody test or because you were infected 6 months ago doesn't mean you're safe for the next surge, for both of those reasons. So again, and like I've said before, this isn't a new or surprising thing. If this acted like measles or rubella or chickenpox, you would only need your 2 shots. But this virus doesn't act like those two. So you need to drop your ideas about measles and chickenpox because this is not the same kind of virus. If anything, it's like most other vaccines where you need 1, 2, and 3 doses and sometimes a fourth booster dose the next year. Or like influenza, you may need yearly shots, or like Tdap, you may end up needing shots every 5 to 10 years, for example. So people need to get off this idea that it's one and done like measles and varicella, because that is not how a coronavirus acts. It acts more like these other viruses, and we need to start adopting that mentality and thought process for how we're going to protect against this. And so natural immunity, the problem with natural immunity is, one, it's very unpredictable. And so this quote from Dr. Peter Hotez, basically, the variation is just highly variable, and so sometimes it works, sometimes it doesn't. We now have good data where they are actually tracking reinfections. So Oklahoma State Department of Health did track combinations of people who've been A, vaccinated, or B, or people who had coronavirus before to see which one works better. And here's the raw data. They actually looked at the people who've actually been infected before, who got infected again, versus the people who vaccinated who had a breakthrough infection. And what you'll see is the protectiveness of the vaccine is much better than having had coronavirus, actually. So they're having more than 2 times the rates of reinfection for people who had natural immunity versus vaccine-induced immunity. And so what the real answer is, if you've had the coronavirus before, you should then get vaccinated, because the data shows that that actually gives you even a better protection after the fact. And here we have basically a study out of in Kentucky where that's what they did. They looked at the people who had had an infection and then some who got vaccinated and some that didn't. And that vaccine did give you more than 2 times the protection by giving that vaccine. And so a natural immunity is not good enough by itself. Um, and so hopefully this is finally convincing some of the vaccine hesitant to get vaccinated. Turns out, unfortunately, that full FDA approval didn't make a very big difference in vaccination uptake. So if you look at the people who are hesitant and what convinced them, well, it's a combination of things. There's not one variable. One of the things is, well, Delta did scare some people. Knowing some people, if you know people who end up in the hospital or got really sick, that tends to convince you. Sometimes it's just because you want to go places. So interestingly enough, one of the reasons I decided to go ahead and get my third Moderna is that we've got a trip coming up and that requires you to be vaccinated. If they change that definition to 3 shots, I want to have those 3 shots so we can go on our trip. So allowing to do things like going to a gym, concert, or event or travel, that convinces people. So again, that's why another reason why I think we need to have vaccine requirements and verification. Having your employer require it does make a difference. Some social pressure, all those make a difference, and so I am in favor of the employer vaccine mandate. All those things can help us get past this thing and be done with this pandemic. So again, here's the source study, which I've linked in the notes section from Kaiser if you want to read more about it. And we'll be having more waves. So Dr. Caitlin Gentilini had a nice good update here yesterday. Is this the last wave? And the answer is nobody really knows at this point. We sure hope it is. There's a chance it is, but we won't know until probably March or April next year whether this is going to be our last wave or not. The biggest way to protect against this is getting as many people vaccinated as possible. Because we know, basically we've already proven that natural immunity by itself is not going to stop stuff. Last, we'll just talk about pregnant women and children. I think this is a big area where we need to make some improvement pretty quickly. This study out of Mexico, actually the leading cause of maternal mortality in Mexico right now is coronavirus vaccination. So we need to get women who are pregnant, convinced that yes, they need to get that vaccine. There was an emergency alert from the CDC about this very subject. 97% of pregnant people hospitalized with SARS-CoV-2 are unvaccinated. There's an increased risk of adverse pregnancy and neonatal outcomes, including stillbirths. And so a woman who is pregnant and gets coronavirus can transmit that virus to her baby in the uterus, and it can kill the baby. It's rare, but it does happen. And we have had a maternal death here in Lincoln from that. And unfortunately, only 31% of pregnant people are vaccinated. So we need to get our pregnant women vaccinated and get them kind of dispel some of these myths so we can get them vaccinated and prevent some of these avoidable maternal and child deaths. Lastly, we still an unknown yet. The FDA does have data now from Pfizer and hopefully Moderna soon. Hopefully, we'll have vaccinations for 5 to 11-year-olds in the next month or two. That'll make things a lot simpler in schools. So fingers crossed, but the jury's still out on that one. Just to finish with a few kind of, I guess, parting thoughts. Knowledge is no guarantee of good behavior, but ignorance is a virtual guarantee of bad behavior. So we need to get people more educated on how pandemics really work. There's just so much misinformation out there. So hopefully we can get more people looking at sources and really looking at the data and not getting all their information from conspiracy theory sites and YouTube channels. Yes, this is a YouTube channel, but I have all my references. Any other problem we're running into, and this is a school problem. I thought this was a good op-ed. We're all just so damn angry, and one of the problems we're having in schools right now is just problems with fights and challenges we're having at schools. I think everybody's angry. It's time that we got over some of this. So again, it's worth your I think read. And again, I think that brings back home full circle to Abraham Lincoln. It's time to bind up everybody's wounds and get past all this. Hopefully some of the contentiousness, we can get past it just by looking at the data and starting to be civil with each other again. I don't know. Not sure what else to say about that, but I think these are worth thinking through and reading yourself. So hopefully this is helpful to you. Again, here's what I do for a living, so you can verify who I am. Everything I've referenced is down in the notes section if you want to read through the source articles yourselves. And disclaimer, these are my opinions, not necessarily those of the folks I work with and for.